All right, nice ladies. I need from every one of you to remember the following. From now, each chapter we will save one word. What we mean by one word? This word will give us the key for understanding all the chapter. Like what? I will tell you when we go throughout this course, I'm telling you that for today's chapter, which is chapter 7, which we are going to talk about sinus rhythm, I need you to put in your mind so far we have the item which is normal. So this means sinus. What is the normal? If you remember from the previous lecture that we have 5 items. If we report these 5 items, we will get clear strip analysis. So if we find number 1, number 2, number 3, number 4, number 5, all of them belong to the normal criteria, so this will be normal EKG. And normal EKG in our language as cardiologists, we will say it is sinus rhythm. What we mean by the word sinus, if we remember that we mentioned SA node. The SA node rhythm is very unique. It is normal. So if our heart following the SA node, like the heart rate is like from 60 up to 100 beats per minute. So this is like regarding the heart rate. So it is normal and it is regular, and the PR interval and the P wave is upright and smooth and precede each QRS, and the PR interval range between 0.12 to 0.20 seconds, and the QRS also less than 0.12 seconds. If we find all of these criteria like within the normal value, we give the name, and instead of saying normal rhythm, we will say sinus rhythm. You got it? So when you find the word sinus, remember this means it is normal. Okay? Let us go. So what we need to know, as I told you, our book is so good. It reminds us for everything we had in the previous chapters. And the introduction for this chapter is talking about what is the site of origin of the sinus rhythm. We know this diagram, which is very clear. We have the SA node, and we know where the location of SA node and how much rate coming out from SA node. So everything like going to be like reviewed. So first of all, site of origin. And after that, the number of pulses or impulse of electricity coming from the SA node. We have this number. And this is what we call inheritant or intrinsic rate. This is the normal one. Normal one. Why? Because sometimes we make like the heart rate getting slower by medication, or it is not compatible with the normal range. So what we mean by inheritant means it is the original one which comes from since birth, okay? Inheritant or intrinsic rate. And we call it is a sinus rhythm because it comes from the SA node. And we have here the pathway, like we mentioned before, from SA node. It will go through the internodal pathway, as I told you, going to the both atriums, then it reaches to the AV node. This is why we call internodal pathway. Then we have the AV node, and we learn together where the AV node located, and after that we get the bundle of Hess, and we are familiar that the bundle of Hess is located in the interventricular septum. Then the bundle of Hess will subdivide it and branch into right and left bundle branch, and the right one going to the right ventricle, and the left one going to the left ventricle, and eventually we get the Purkinje fibers, which is in the ventricular musculature itself. And this also, the Purkinje fiber, it has its own rhythm. So here, as I told you, I need everyone to remember this pathway, which is very important. And also, as I told you, when you find these slides means a lot, that it is the golden slide. And what is the golden slide? It is the summary for what should you know about the previous paragraphs. This is another revision telling you that what is the intrinsic firing rate of the SA node, what is the intrinsic for the AV node, and what is the intrinsic for the Purkinje fiber, which is 3 big subjects. We are going to talk about them. But for today, we are going to focus on the SA or sinoatrial node and its firing rate and the variation, if we find it, what should be. Then, as I told you, when we find everything as a normal, this is what we call normal sinus rhythm. What is the abbreviation? NSR. N stands for normal, S stands for sinus, R stands for rhythm. Is it clear? Any questions so far? All right. Like I told you, if we have the 5 answers for the 5 steps coming with the answer as normal, so this is what we call normal sinus rhythm. Then we have the normal sinus rhythm pathway. It will also start to give you the story that the SA node will going to generate the impulse, and the impulse is going to the internodal pathway, activating both atrium. Then it will going to the AV node, and after that going to the bundle of Hess, then going to the branch, then going to the Purkinje. So it will be like repeating all the information which already we have. And again, these slides repeat all of them in order to make like you refresh your knowledge and get familiar about what is the next step, which we are going to talk about it. So all of them is going to be normal. So we call again the word sinus. Here, if you need to save all what we mentioned from we started this course, you will find it all of them here. All the information, as you see, we have 5 steps, 1, 2, 3, 4, 5, you see. Then each one has limit of normality. So if we find all of them, we will say this is normal sinus rhythm. And if we go to practice with these slides, it will be very, very interesting. So I need everyone to share with me just to let you know that everything with us is going smooth. Who can participate with me?
I can.
Okay. Let us start. Number 1, what should you report? The first step. What is the first step?
Report the heart rate.
Very good. What is the heart rate?
It has to be within 6 to 100 beats per minute. So it's 1, 2, 3, 4, 5, 6, 7. So it's 80 beats per minute.
Let us count. 1, 2, 3, 4, 5, 6, 7. Just 7.
7.
Or you can consider this one is just a start. Oh, it's okay. 8.
Yeah.
Correct. Okay. So the heart rate here is 80 beats per minute. Very good. What is the second step?
What is the rhythm to make sure the rhythm is normal?
Yes, very good. What is the normality here?
Make sure P is followed by QRS.
No, the rhythm is related to the distance between R and R should be fixed. This is if you need to comment on the rhythm, look for R to R distance.
So they look even.
Look even. So this is regular. Very good. What is the third step?
Is there a P wave before each QRS? So there is.
Very good. And what is the criteria of P?
If it's
Not if it is in front of you. Don't put consideration. You have a EKG of a patient and you report it. So in this case, what is the P in this situation?
it's a smooth.
Yes.
It goes over smoothly.
Upright.
Upright in the positive.
Okay. Upright means positive. Very good. So smooth, upright or positive, correct? And each P wave precede QRS. Very good. Very good. What about number 4 step?
What is the length of the PR interval?
Okay, how many? 1, 2, 3, 4. I can count that there are 4 or 5. 4 or 5 small boxes. So what is the time if it is 4 or 5?
4 or 5, it should be around 12 to 20 seconds.
So in this case,
it has 0.20 seconds. Right?
0 point?
Yeah.
Okay, not 0.20. Okay, if it is like 5. So this is normal?
Yeah.
Very good. So this is the 4th step. What is the 5th step?
Do all QRS complexes look alike?
Okay, what else?
So they all look even and they all have the 2 squares in between?
Yes, so the timing of the QRS is like 2 small boxes, and we know that the time should be like 0.8, right? 0.08, 0.08 seconds. So this is within normal. So wonderful, Yesina, that you find everything in this EKG strip, which is within normal. So what you are going to give the name?
Sinus rhythm.
Very good. You got it, guys, how to go? So she followed the rule. She has to answer each step separately, and according, if it is okay, normal, she will say normal. If there is like variation, like we are going to find very soon, so she has to mention the variation. And according to the outcome answer of the 5 steps, she will reach the final diagnosis or impression, which is a very good job for you guys. Okay? Thank you, Yesina. Then we have the first variation. What is the first variation? Like we mentioned, the first step is heart rate, and we know that the normal heart rate should be between 60 up to 100. If I find that the heart rate is not reach this 60, so it will be less than normal, and we know that the word which the heart is less than normal, it is bradycardia, and after that everything is normal. So this is the only variation within or out of the normal. So we will say sinus bradycardia. You got it? So we have only one abnormal issue, which is the heart rate. If the heart rate is exceeding this 100, it will be tachycardia. So we will say sinus tachycardia. That's it. So far, we have the rest of the knowledge, or the rest of the 5 steps come out as a normal, only the variation, which is the heart rate. So we can give the first diagnosis, which is sinus bradycardia or sinus tachycardia. Let us cover another point. If this situation is a real disease, it is not a real disease. Because if I have sinus bradycardia, or if I have sinus tachycardia, the doctor will never give me any medication and he will ask me, go home, no problem. Okay? So this condition is not necessitate any support or any assistance from the provider. Is it clear, guys? What is the sinus bradycardia? Sometimes you have to read these items. Sometimes the patient, not all patients, sometimes the patient start to vomit, suffer from hypoxia, means decreased oxygen, because the heart is slower than the normal. And we have cases like we mentioned before, beta blocker. I need you to remember this medication. Beta blocker slow down the heart. Beta blocker slow down the heart. And digitalis, which we use for treatment of heart failure, is also slow down the heart. So this is why we mentioned before that the intrinsic or inherited trait, which is the normal one, but if I have effect of medication to make it like slower, so this is what we call sinus bradycardia. Then we are going to the golden slides, and the golden slides will give, if you compare these slides with the previous slides, you find everything like typical or copy and paste, except the first one, which is the heartbeat is less than 60. That's it. It is easy or difficult? Let me know. Share with me. It's okay? All right. Let us have example of, I don't need you to look for the header, because I need you to practice and learn by yourself how can you reach this header. So ignore this header and let us start together to answer the 5 steps. Who can do this with me?
I can do this.
All right, go on.
So the first one is the heart rate. 1, 2, 3, 4 is 40.
Okay, 40. Very good.
And then it's the second. I can see that it's regular.
Regular, correct? Because she noted that the R interval almost the same. Okay, very good. Very good.
And the third, P rate is or before each QRS.
Very good. And it is what? What is the character of
the
this
P
P wave?
rate is smooth and upright.
Very good. Perfect.
And then number 4, I count. It's 4 small bus.
Yes.
And then it is 0.16.
Okay, so it is 0.16. Second, the PR interval. Very good.
And then the QRS complexes look alike.
Yes,
Yes. And then I count is two. Two
very good,
small pulses.
very good. So wonderful. So Jennifer find everything is like normal except the heart rate, which is like 40 below the normal. So she will put the diagnosis sinus bradycardia. Perfect, perfect, perfect. Thank you, Jennifer. Here we have the second variation, which is sinus tachycardia. So sinus tachycardia, it will be like similar to the description of sinus bradycardia, but the problem is the heart rate is above 100. And if we compare also the golden slides, it will tell us that everything is like, yes, normal, except the heart rate range between 100 up to 160 beats per minute. Let us go by this very famous EKG strip, which is coming frequently in all the exams. So pay attention for this. Who can go by these slides with me?
I can try again.
Shy, don't get, students don't get shy, sorry. I need everyone to practice. Do mistake as you like, no problem. I am here to correct you.
I'll do
But
it.
if you,
Okay.
you can't go,
Oh, or did you want to go, or did you want me to?
You can,
You
it's
can
okay.
go.
Go ahead.
Oh, okay. I'll go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 110 beats per minute.
Is it 120 beats a minute?
yes, 120, very good.
The heart rhythm, it looks normal.
Normal, because if you compare R to R, it looks like the same. Okay, correct.
The P wave is upright, smooth,
Yes, correct.
and the PR interval is
No, before. Yeah, it
Oh,
is smooth,
oh.
upright, and
before the QRS.
very good. HP followed by QRS. Very good.
And then the PR interval is
1,
5.
2, 3, 4. Just 4.
Oh, 4. Okay.
Yeah.
Okay,
No,
4.
actually, it is 5. You are right. 5.
5. Okay.
So it will be 0.04 times 5 equal 0.20.
0.20.
Very good.
And
Then the
then
last.
the QR complex.
Mm,
It is sharp and pointed.
yes.
And
How many small square boxes? 2.
it is, I can't see, hold on. Is it 2?
Yes.
0.10?
No, 2.
0.2.
0.8. 0.08.
Oh yes, 0.08, sorry.
Mm.
Okay.
So what this? You find everything is normal except the heart rate exceeds the 100. So it is what?
Normal or tachycardic?
Not normal.
Tachycardic.
Sinus tachycardia. Don't say normal. From now, we don't use the word normal. Normal is in your memory, okay? So we mentioned sinus tachycardia.
Okay.
All right, very good job. Thank you, Shirley. Then we have another condition which is not normal, but also it doesn't need any medical assistance. What this situation? The situation is called sinus, and we know that the word sinus means normal. Dysrhythmia. So this is the second situation. We are going to talk about the rhythm. So dysrhythmia, this means bad or irregular or not functioning correct arrhythmia. So what this is also happen if we look for the RR interval is like varies. We have certain variation between RR interval. If it is fixed, we will say that it is rhythmic or regular, right? But if we noted that RR interval, it is not the same all the time, this will guide us to put the diagnosis, which is dysrhythmia. But what about the rest of the 5 steps? They will be normal. So we are going all the EKG, we are going to play with one item, and the remaining items will be like the same. Like what, guys? We are like, I am like in front of you. If I change you have my criteria that I'm not having like blue eyes. But if you find me that I have blue eyes, so this means what? This is the only variation. He looks like Dr. Israel, but it is not like him, or he is not like him exactly. Why? There is one variation. You familiar about my eyes is not blue, but you find that this Dr. Israel with blue eyes, so he has one item differs. So this is what we call one item, and we are going to play and make a change in any item, and according to any item abnormality or abnormal findings, we will get a disease. So let us go to find what is the sinus dysrhythmia. If we look the same previous or the first slide, you find everything is the same except the second step. It is not regular. So it is irregular. That's it. So EKG is very easy subject. So far you have a wonderful background, so you can play with any strip. All right. We have here, again, I don't need you to look to the header. I need any one of us go together for what is this. Yesina, make your mic mute if you don't answer.
Sorry.
Okay, no problem. Okay, who can go by these slides?
Yes.
Okay, go.
So the heartbeat is 90.
Very good. 1, 2, 3, 4, 5, 6, 7, 8, 9. Very good. 90 beats per minute.
And then second, I can see that on the out point is irregular.
All right. So R to R is not similarity. So let us check together which one is normal. So from here to here, it is the same like from here to here. It is the same if we go from here to here. It is the same if we go also from here to here and also from here to here. So all this green arrow represent equal RR interval. But if we look to the variation, we noted that here is not the same time. Here, it is not the same time, like the green. Also here, like the green. So we noted that there is a variation between RR, and according to this, Jennifer considered this is irregular, which is very correct. Okay, keep going.
Okay. Yes, the P wave is before each QRS,
Yes,
and I can see the P wave is smooth and upright.
very good.
Then let me can. And then I count is 5 small squares.
Very good.
So,
Equal.
yes.
Equal how much time?
So it's 0.20.
Correct. Hmm?
Okay, and then all the QRS compressors look alike. Yes.
Very good.
And
Time.
count is QRS compressors is 2 small squares.
Yes, correct.
So it's 0.08.
Very good. Perfect. So Jennifer find everything normal except the regularity is not regular. And according to this, she will put the diagnosis, which is sinus dysrhythmia. Are you familiar now? No? How to go by the strips? Easy? All right. Then we have another point, which is what we call arrest. Look for the word arrest by itself. Do you hear about cardiac arrest? What we mean by cardiac arrest? The heart stop. So sinus arrest means the SA node stop to give impulse. So far, the SA node stops to give impulse. I will get P and Q and R and S and T are lost. Okay? So this like the electricity outage of our home for a second or 2 seconds. So you find that the lamp shut down, all the lamp shut down, the fridge, everything shut down and come back to normal. So this is what we call sinus arrest rhythm. Let us see how this looks like, and it will be very interesting. Look, guys, this is the strip. What you notice? I need one to share with me.
That is a gap in between
This one, second one, and
the second
one.
and third heartbeat.
All right. So this gap, do you notice any normal wave? No.
No.
There is no P, there is no Q, there is no R, there is no S, there is no T, right? So if we consider like the heart rate is regular, and we consider that 1, 2, 3, 4, we have almost four big square between this R and this R. Here, it is the same, almost 1, 2, 3, 4. So let us make a drawing to give you impression how many beats are not there. Why? Because of the absence of the SA node. So let us consider 1, 2, 3, 4. So I have to get one here. 1, 2, 3, 4. So I have to get another one here, and then 1, 2, 3, 4, I will get the 1. So I missed how many beats here? 2. You got it, guys? So this is, and after that, I restore back, my heart restore back its normal activity. Like this is the P wave, QRS, T, P, QRS, T, and we have everything is like within normal. So this kind of rhythm, I will mention that this is sinus arrest. Clear? Clear? Sinus arrest. Sometimes, guys, this happened to us every now and then that you find that sometimes, but we don't feel it much. You find that your heart is boom, boom, go like you have a drop beat. You have a drop beat. So this is exactly what happened, is what we call sinus arrest rhythm. It needs emergency? No. It needs any medication? No. It needs any assessment? Just assure the patient that everything is okay. Clear? Thank you. Another one. Let us go. We have to read this clinical significance of sinus rhythm, that we know that if the blood outcome or the output of the heart blood is not sufficient, we will start to get like weakness, fainting, dizziness, and decreased blood pressure. And all of these are like symptomatic or medically unstable, which is like not stand for long time. For sinus bradycardia, what should we do? As I told you, it is not a big problem, but read for your information. And also for sinus tachycardia, what is the situation? And sinus dysrhythmia and sinus arrhythmia, all of these we are discussed, all of these items. And after that, you will find the following. At the end of each chapter, ladies, you will get chapter review strips. I need everyone to work on it. Everyone has to work on it. And God willing, on lab time, I need to see your, because today we are going to have chapter 7, tomorrow we are going to finish chapter 8, and I need to see all of these strips are already answered in your book to give you credit. Let us practice together how to go such type of assignment. As you see, it is making your job easy. What this? This is the first step. So you count, what is the heart rate? 1, 2, 3, 4, 5, 6, 7. You put number 7 here. 70 beats per minute, okay? Cameron, are you following? Okay, so you put here 70 beats per minute. The second answer, rhythm. How can I get rhythm? I count the distance between R and R, and I find that it is almost equal, so I will say regular. Then I will give comment to the P wave like you practice now. Then you count the PR interval. PRI means PR interval. You count how many small boxes and you multiply the number by 0.04. It will be the time of the PR interval. Then you report on the QRS as a time, how much in seconds, and if it is like narrow or what. Then you put the interpretation, which is like what is this one. You would say that this is sinus, normal sinus rhythm. That's it. Okay, so I need you to start read the chapter and get familiar for all the topics which we mentioned, and start to finish all of these strips on your chapter review at the back of each chapter, and this will make your job much updated, and you will get enjoying the study. Of course, if you have any question, you are so welcome, And of course, if you are going to miss any one of these chapters, lectures, you will find that you are not capable to follow the next one. So we learned today one word, which is sinus, means normal. What we mean by normal, the 5 steps are normal. If I have variation in number of the heart rate, I will say sinus tachycardia or sinus bradycardia. If I have variation in the rhythm, I will say sinus dysrhythmia. If I have variation in like absence of the PQRST, I will say sinus arrest. You got it? So we touched today 4 diseases or 4 abnormal condition of the heart: sinus tachycardia, sinus bradycardia, sinus dysrhythmia, sinus arrest. That's it. Any questions so far? All right, I'm going to take the attendance. I know you are in front of me. I will go to take the attendance. All right. See you tomorrow, guys. Enjoy the rest of the day and enjoy study of EKG.
Thank you, Doctor.
Thank you, Professor.
Thank you,
Bye.
You're
Doctor. Bye-bye.
Bye-bye.